Hi guys, I'm Dr. Paresis and welcome to another video. So today's going to be a slightly different video. I've been sent a number of public online forum posts to react to. So that's what I thought I'd do today. Now, I thought this could be quite fun, but also a chance to look at some real world hair loss mistakes and lessons from a medical point of view. Of course, any of the advice that I give in this video is not personal advice. If you're worried about your hair, you should always consult your own doctor. So here we have what looks like a young man, 29 years old, and he asks, is this salvageable? He says his hair is pretty thick aside from the front and doesn't look anywhere near this bad normally, but pulled back it is bad. Here's another photo. So looks to me like a classic male pattern baldness patient. He's got clear hairline recession, looks to be around a Norwood 3. At 29 years old, this isn't particularly aggressive, but certainly with that intervention, he'll continue to lose hair. Again, another photo here. You can see he does have some mild thinning in the central tuft as well, which also suggests that he's due for more loss in the future. Is this salvageable? Absolutely. A DHT blocker like Finasteride should stop the hairline recession, so those corners there should stay where they are. I also think he could get some regrowth in the central tuft. It's unlikely that the DHT blocker is going to regrow hair in the already receded temples there. Minoxidil as well will probably help with the central tuft, boosting it again. Again, I think it's unlikely he's going to get regrowth in the temple areas. He may, take medications, prevent further loss, get a thicker central tuft, and be happy with what looks like a mature masculine hairline. But if he wanted to restore what he had lost, then something like 2,000 grafts would probably do the trick for this gentleman. We'd pack 1,000 grafts either side of that central tuft in those temple areas, and with good growth, and if his physiology took those grafts well, then he would be in pretty good shape in a year to 2 years from now. Here's another guy who says, what the heck, I'm just 20. What am I dealing with? He asks, can someone help me out? Okay, so this is an example of severely aggressive male pattern baldness. At 20 years old, he has significant crown loss. He has evidence of crown dipping, which you can see in this area here. You can tell that in the future, the crown loss is going to dip further into the donor area. He also has quite a thin donor area, which suggests that there are some DHT sensitive follicles within that donor area. You can see some evidence of retrograde alopecia at the back there in the posterior hairline, and just a mild diffuse loss throughout the donor area. And if I'm honest, this patient, if he's not on medications already, is in this state may not be a candidate for hair transplant surgery. I would have to get him in, get him under the trichoscope, have a look at those hair follicles in the donor area more closely to see, okay, are there unminiaturized hairs there? Are there any viable hairs that we can transplant? Medications would help this guy overall, there's no doubt about that. He might prevent that crown from dipping further. Again, we can't see the front of the scalp, but certainly the crown has been hit very hard, and this is probably going to be quite an uphill battle for him, being 20 years old with such advanced hair loss. You almost wouldn't know I'm pushing Norwood 3, the power of long hair. Pictures are all the same day, only difference is the way I style my hair. Okay, so looks like a normal head of hair from this photo here, looks like a young guy. Again, the same from this side. Okay, here you can see there's a few signs of loss in that, in the temples. But when he pulls things back, it's a lot more obvious. And here, of course, you can see there is quite significant recession, and it's looking like it's eating, further back as well. So, here's a young man showing the power of styling his hair, hiding his male pattern baldness. And I absolutely agree. There are so many guys I've seen that they don't even need to treat their hair loss for a very long period because they have so much hair elsewhere. Outside of the areas that they've lost hair, they've got so much hair density that they can often use that to style their hair in a way that hides their hair loss. And I've seen people stave off a transplant for 5 to 10 years because of this. So the power of hairstyling cannot be understated, actually. I also think the trend of young guys pushing their hair forward, the so-called broccoli hair look, which is super common and is great. Also helps with hiding receding hairlines. I'm not sure that's why it exists, but I think it's probably not. It's just the fashion. But look, it helps with receding hairlines anyway. This is another hair transplant patient who's 7 months after getting a hair transplant asking, have I lost a graft? So from the look of this, what do you guys think? I do not believe he has lost a graft 7 months after a hair transplant. I mean, usually when we do a hair transplant, we put them in about 4 millimeters deep. That's how far we put the graft in. And it is quite literally in the dermis, which is, even deeper than the epidermis. There's actually an interesting study that this makes me think of by Dr. Bernstein, who found that after day 5, so from day 6 onwards, it's quite literally impossible to remove a hair transplant graft. You can see it says that after the first 2 days, pulling on the hair always resulted in a lost graft, so after 2 days. And then by the 6th day, they were unable to dislodge the hair graft. So what do I think is going on here? Well, I think that this is likely because of a bit of pulling and tugging. And what you can see at the base here that looks like a hair graft is actually a keratin plug. Hair is made of protein called keratin, and keratin builds up at the base of the hair. And that's why sometimes when you have a hair shed, now it would take a little bit more of a pull or trauma to pull out the hair with a keratin plug. But it's very, very normal. And I get a lot of patients sending me photos like this saying, is this my hair graft that has come out? And the answer is no, it's a keratin plug, and that hair follicle will still regrow. Here we have a 25-year-old guy who is 9 months on finasteride sharing his results. He says, 25 years old, noticed some thinning a couple of months ago, inconsistently used minoxidil, a bunch of baby hairs have grown. I think I went from like a Norwood 2.7 to Norwood 2.3. I love how specific he is there, because the Norwood scale actually has limitations. I believe that it's too crude. It's not specific enough. And between a Norwood 2 and a Norwood 3, there are lots of different stages. So I agree that he is using, Norwood 2.7 to 2.3. Looking at the photos, I agree that he's not quite a Norwood 3 in the first photo, close to it, pushing it without intervention. And you can see after 9 months, he has quite impressive regrowth of the frontal hairline follicles. This is after 9 months, so he's likely to have more regrowth. And I believe that he's had such good regrowth in the hairline there because he's so young. But this is quite unusual. And I have to stress that the hairline really doesn't usually regrow from medications. I do believe that these baby hairs are not going to fully grow out. What we often see is the regrowth of the baby hairs, but they don't have their full anagen phase anymore because they've been damaged too far. It would be good to see updated photos of this guy. I'd be interested to see what portion of those baby hairs regrow fully after, say, 12 months up to 18 months. It'd be interesting. Counter update. Sebum's transplant doesn't look super good now. He says he's clearly balding at his temples while his transplanted hair and artificial hairline grows. It's not connecting and makes for a strange look. To me, it's the clear difference in hair density on top of length that gives it away. This is not to say he hasn't made great progress with his transplant, because he definitely has. Right. So I have actually made a video with Dr. Bloxham discussing Chris Bumstead's hair transplant. He's obviously a big person in the bodybuilding field, but he went to Turkey and got a hair transplant. Now you can see what this guy is talking about in terms of Chris Bumstead's hair transplant looking artificial. Now my view on it, and this is subjective because cosmetic results are subjective, is that he looks great. Did he solve the problem of his receding hairline? Absolutely. And the hair transplant actually grew relatively well. But we don't know how many grafts they use. And one habit that Turkish hair transplant clinics do is that they over-harvest the donor area. So this looks to me like about 2,000 grafts placed in the hairline, but because it was a Turkish hair transplant clinic, it could be anywhere up to 3,000, even 3,500, 4,000 grafts that they put here. I have to say that in these photos as well, the donor area does look a little bit patchy as well, which does suggest they took quite a few grafts from the donor area by FUE. In my subjective opinion, the main issue with Chris Bumstead's hair transplant is the hairline design. It's much too flat and low in my opinion, and it's not necessarily going to age well. The issue with male pattern baldness is that it is progressive, and being progressive, the hair loss will continue behind the hair transplanted area if the patient's not taking medications. Because Chris has committed to this very low hairline, if he continues to lose more hair, then it's much more likely that he will see gaps between the strong transplanted area and the hair behind. He's now got a big surface area to cover with a limited donor supply. He probably would have been in a better position if they did a little bit more of a conservative approach with putting in a little bit of hairline recession, which is natural and would have aged well. But it also would have meant that the surface area for him to cover in the future, should he lose more hair, would be slightly less, and therefore he'd be in a more manageable situation to get full coverage of his hair for life. I also believe, looking closely at the hairline, that they did use multi-hair grafts, which is very surprising because that is quite textbook for hair transplant surgery. It's the thing that you are taught on day one, not to put multi-hair grafts, in other words, hair grafts that contain 2, 3, 4 hairs per follicle, not to put those in the hairline because that's what gives a pluggy and unnatural appearance. And I can see that, there is that appearance there. And I do believe it's because they put multi-hair grafts. At our clinic, for example, not to compare, there are some Turkish clinics that do great work and most of them do put single hair grafts in the hairline. But at our clinic, we really prioritize that. We put single hair grafts in the hairline and it almost gives less density in the hairline, which patients might say, oh, I'm not happy with that. I want as much density as possible. But you don't want as much density as possible right away, because then the contrast between the skin and the hair is unnatural. It's too severe, it's too sudden. Instead, we create a feathered, natural hairline that grows in density as you look back. And that's what naturally occurs. If you look at people with no hair loss, even they have a natural increase in density moving back. And that's because in nature, the hair follicles at the front of the hairline are single hair follicles. Okay, so we've got quite a detailed post from a patient here who says, 6 years of progress, been getting ragged on a lot for my hairline. Should I just give up already and shave it? Interesting question. He's given quite a few photos which are from 2019 to 2025. He said he noticed hair loss in his teens, and he says that his brother, who had long blonde hair, was a Norwood 6 by age 18, which is very difficult to believe, but wow, that is extremely severe loss. He says he managed to stick it out until 2017 when he was 23 years old, at which point started to take notice and started using minoxidil liquid and saw palmetto pills for 2 years up until 2019. So this photo is from 2019, meaning he must be 25 years old in this photo. So at 25 years old with this loss on just minoxidil and saw palmetto, you can see evidence of crown loss and mid-scalp loss as well. You can also see the hairline is receded and there's overall loss of density. He says in 2019, he finally decided to try Finasteride. So this is him starting Finasteride. This was in 2021, 2022, 2024, where he actually is continuing to lose hair. So this is him, despite taking Finasteride, he is continuing to lose hair. And he says at this point in 2024, that's when he decided he wasn't satisfied with the results and he switched to dutasteride. This is him on dutasteride. So he continued to lose more hair despite starting dutasteride. He says, comparing today to when I started Finasteride, I feel like I lost the battle. I've tried consistent microneedling along with red lamp and a bunch of other stuff to include peptides, pills, nutrition. My next step is a blood panel to see if maybe I have some not so obvious deficiency or disease than a scalp biopsy. But I don't have the money or time for a trip to Turkey, so I'm wondering if I should just give in, shave, and not deal with the social anxiety. Okay, so a few things here. First of all, this is someone who is clearly very distressed by their hair loss. They've been battling hair loss for over 7 years, and this has clearly been a difficult journey for this guy. One of the issues that sticks out is that this patient only started Finasteride at age 25. Now, with such strong family history, with his brother being Norwood 6 at age 18, and with him clearly having quite severe loss, it was probably a better idea to start Finasteride sooner than age 25. Then again, what's surprising is that he took Finasteride, and look at how much hair loss he continued to experience. This is a quite severe aggressive progression from what looks like diffuse thinning to becoming a Norwood 4, even perhaps a Norwood 5, despite taking Finasteride for 5 years and dutasteride for a year. And again, this highlights a point that I have made in lots of my videos. A lot of people take issue with it. And that's the idea that hair loss continues for some men despite taking 5-alpha reductase blockers. DHT sensitivity can be so high in some patients that hair loss continues despite taking dutasteride, which blocks over 90% of DHT, so theoretically should stop hair loss for good. Now, I'm not sure about this patient's compliance, whether he actually took his Finasteride and dutasteride doses every day, you never know. But a point I want to stress is that there is a group of patients where Finasteride and dutasteride do not stop further loss. For these patients, they have two routes. Number one, it's to accept their hair loss and shave, and number two, is hair transplant surgery. And that's when FUT comes in as a technique that maximizes the number of grafts over the patient's lifetime. I have mathematically proven, and so have a few of my colleagues, that starting with FUT hair transplant surgery instead of starting with FUE gets the average patient 3,000 more grafts over their lifetime. 3,000 grafts is enough to cover 1/3 of the scalp with very good density. So 3,000 grafts is a lot of grafts. This is a patient who would definitely benefit from starting with FUT if he was to choose to go for hair transplant surgery. Here's another hair transplant patient who says, 8 months post query failed hair transplant. Was told I got 1,200 grafts, low graft survival, or did I just not get enough grafts to begin with? Okay, so looking at the photo here, you can see he had a frontal band procedure. Frontal band procedure is the most commonly performed hair transplant out there. This is just post-op, so right after the procedure. And here's another photograph. This is 8 months after the procedure. So yes, the growth is not ideal. It also looks mildly pluggy, and there's quite a clear difference between the frontal band area and just behind. 1,200 grafts is an appropriate graft number for this surface area of the scalp. I do believe that it's an appropriate number of grafts for this patient. The angle of the grafts looks mostly correct. The growth isn't perfect, but it is only 8 months after the procedure, and he could be a slow grower. For whatever reason, we do have a group of patients that grow slower. In the end, we find that they catch up with the rest, but in terms of how quickly the transplanted hair grafts grow out, they do take longer. In my experience, it's best to wait until at least 10 months before judging a hair transplant. Okay, so another detailed post here. He says 18 months of treatment, my honest journey, before and after. So this is 18 months of treatment, starting with oral finasteride and once daily minoxidil foam. He says he stayed consistent. He said he did experience hair shedding throughout, but slowly saw improvement. After 12 months, he said he tried to boost results by adding topical minoxidil and topical finasteride on top of this. He says he did this for 3.5 months, but felt it worsened things. So he stopped that topical solution 1 week ago and is now just continuing to take the oral finasteride and topical minoxidil. So looking at the before and after pictures, you can see quite an impressive result. I love that this patient waited 18 months before sharing this. It is much more reliable. 18 months is a perfect time to assess before and after hair loss photos. You can see before he looks to have about 6 to 7 out of 10 severity of crown loss. You can see the area of loss is actually quite wide, but he's had almost full regrowth. I mean, that is incredible. That crown has beautifully filled in. I expect it's mainly going to be the minoxidil that has given most of the regrowth, but the finasteride will have helped as well. This patient looks quite young from the photographs, so I imagine this was one reason why he got such good regrowth, because he didn't wait for those follicles to be overly damaged. And when you wait, the longer you wait for treatment, the less likely you are to regrow those damaged hair follicles. That's awesome. Any sides? How old are you? His age, 36. Okay, so he's 36 years old, so not as young as you'd think. And so he's even more lucky. This is impressive crown regrowth at 36 years old. But an important point I'm not surprised by is that crowns are more easy to regrow. For whatever reason, I have seen in my clinical practice that crowns respond to medications much better than hairlines. And that is why I usually refrain from jumping the gun on crown hair transplant surgery if the patient hasn't maxed out hair loss medications. But this is very inspiring, guys. I love seeing stories like this, and it is a very good reason not to give up on fighting hair loss. Thank you guys for watching. I hope this was enjoyable. A little bit more of an infotainment style of video today. I hadn't seen these posts, so it was great to go through them with you, and I hope that you learned a thing or two. My goal moving forward is to provide more entertaining content, but also give value to you guys on the side. I think there's a lot to learn from case studies like this that have been publicly posted, and I'm really excited to make more videos like this. If you're interested in a hair loss consultation where we go through your current level of hair loss, a prediction of your future hair loss, how good your donor area is, and also your options for treating hair loss, shoot me an email at drpriestess@gmail.com where we can absolutely do that. See you in the next video.